With the changes that happen in a woman's body in perimenopause or menopause, the risk of metabolic health conditions like diabetes, cardiovascular disease, or MASLD MASH, formerly fatty liver disease, all increase. Can hormone replacement therapy or HRT reduce this metabolic risk? Well, let's start with weight management. As I blogged previously, and check out the link below for a link to that post, HRT does not result in weight loss and should not be used as a weight management strategy. Some studies have suggested there might be a little less weight gain in women using HRT, but the effect is really small, about 1 or 2 pounds, which is about a half to 1 kilogram. We also don't have convincing evidence that HRT helps to maintain a favorable body composition, in other words, more muscle, less fat. Studies are conflicting as to whether or not HRT has an effect on fat distribution, visceral in and around the abdominal organs versus fat under the skin, which is called subcutaneous fat. The timing of HRT may be important here, though, at least some data suggesting that there may be less central fat deposition in women who receive HRT immediately after menopause. What about diabetes? Well, HRT seems to reduce the risk of developing type 2 diabetes in perimenopausal or menopausal women by anywhere from 21 to 35%. And there's several references for that. Check that out in my post. There's an analysis that suggests that the estimated benefit for women aged 50 to 59 was 11 fewer cases of type 2 diabetes per 1,000 women per 5 years of hormone replacement therapy use. That being said, HRT is not recommended for the goal of diabetes prevention. Next is MASLD MASH or fatty liver disease. The data aren't clear on that, and there's conflicting results. I've blogged about that previously, so I won't go into that more today. What about high blood pressure or hypertension? Well, HRT may actually cause a small increase in blood pressure and does not protect against the development of hypertension. For sleep apnea, the existing data are really inconclusive. Can't say much about that at this point in time. What about cholesterol? Well, oral estrogen taken by mouth has some benefit to cholesterol, more so than the estrogen gel or patch applied to the skin, although some progestrogens can negate that benefit. And hormone replacement therapy should not be used to prevent cholesterol problems. What about cardiovascular disease? Well, that topic is really complex. It's outside the scope of today's discussion. Whether or not hormone replacement therapy increases cardiovascular risk varies by age, type of HRT, and how the HRT is given. HRT is not recommended for the prevention of cardiovascular disease. So the bottom line in the big picture here is that hormone replacement therapy may have a beneficial impact to reduce the risk of diabetes, but might increase the risk of other metabolic health conditions. While HRT may be a valuable strategy for some women struggling with menopausal symptoms, it should not be used solely for metabolic health reasons. HRT does not result in weight loss and should not be used as a weight management strategy. An individualized, holistic strategy to optimize metabolic health in perimenopause and menopause, most often including attention to weight management, is really important.